Welcome to the in-service on standing orders. You should have in front of you a stack of documents. One, an outline of this in-service. Two, the procedure itself. And three packets, each labeled, one labeled hypertension, the second labeled diabetes, the third labeled hypertension and diabetes. In each of these packets, there's several other forms that we will go over later. To start with, we need to define what is a standing order. It has been traditionally, physicians were in charge of all activities and care of a patient. But because of the expansion of knowledge, it is now necessary to delegate certain activities to other staff. In the past, most of these activities have been delegated to nurses. Now they are being delegated to pharmacists, health educators, nursing assistants, and other support staff. And because of the delegation, we need to have very detailed procedures written out as to who would do what and when. Some clinics will just do a broad definition and say, this person will do this if something else goes on. At West Oakland, we have decided to make a list of all activities that certain disease processes will need to have done throughout the year. We have 3 disease processes we wish to follow. One is hypertension, again, the second one is diabetes, and the third is patients who have the combination of the diseases. In the past, most of the chronic illnesses have been very easy to monitor. Diabetes being an example, 60, 70 years ago, there was only one medication to treat diabetes, and that was insulin and diet control. Now we have a lot of other medications which patients can take, but there are also implications of side effects with these medications that need to be monitored. The diabetic patient especially is extremely prone to develop complications not only from the diabetes, but also complications from taking certain medications that we give can control the medication. Simple tests can be done annually to minimize the side effects of these medications and also minimize and maybe delay the prevention of complications from the diabetes. The most simplest is renal failure, which is a very common problem with diabetes. A urine test, a microalbumin, did once a year can detect very early signs of kidney failure. On our standing orders, we have that test done annually. If we look at the first sheet, the standing order sheet, you will see a list of all the ordered tests. The first one is, I will use diabetes and hypertension as the combined standing order because on that particular standing order form is where all the tests are done. Blood pressures are checked at least every visit, and that's for both diabetics and hypertensive. The labs, the potassium level, the microalbumin, the lipids, liver, and kidney tests are done annually. The A1C is did every 3 months. Diagnostic tests like an EKG is did to every 12 months. A foot exam is every visit. And the nursing staff will be trained to do those tests. The chest x-ray is did every 12 months. Immunizations for health maintenance, because people with chronic illnesses tend to develop an impaired immune system, so they're to have a flu shot, a pneumonia, and lately also a Tdap, which is a tetanus and whooping cough combination immunization. Referrals to the foot doctor, the eye doctor, and also the dentist is required annually. The dentist should be every 6 months, but at least once a year. We will also have a standing orders referral to health education so that the patient will get an education not only on the disease process of hypertension, but also how to live a healthy life, how to exercise, how to reduce their stress, how to stop smoking if they smoke, and how to reduce their weight if they're overweight. Things that they need to also learn is how to check their blood sugar. So they will be given classes on glucometer training, and as well as the parameters they need to know in order to notify their provider in case their sugar is too high, what type of diet modifications they can make before notifying their provider just by drinking water or cutting out sugar for the day. Foot care. Diabetics are extremely prone to develop simple infections, can eventually wind up with them having to lose their feet. I had one patient who wore tight shoes for one day, and after about a year of treating the irritations on that foot, she lost the foot. It did not heal. Diabetics have wounds that do not heal. The bottom line is that practically all chronic illness need early detections of complications, and that's what the standing orders are to do. They are to provide us with a way of detecting problems with the kidneys, with the heart, with the liver early on so we can intervene. But because of the time constraints on the provider is no longer able to just routinely remember to do all these tests. So that's why they have been set up as a standing order, and the nursing staff will now order these tests routinely on the first visit the patient comes for the year, and then track it throughout the year to make sure that the test is done and the results are in the chart. We will go over each form. The first form is the standing order form, which I just went over. The second form is a health maintenance form, which is just a revision of the pink form that we used to have in the patient's chart with a list of all the exams that I just went over in the standing order. The third form is the chest x-ray, a EKG, and the labs. All these forms will be filled in, so it is only the medical assistants will only need to put in the patient's name and additional information like the patient will smoke or not. The third form is a health education reform form. Instead of doing a form for each problem, one form will be filled out and given to health education, and then health education will track to make sure that the patient gets appointments to see the smoking cessation health educator, or to see the hypertension educator, and any other health education educator that needs to be hooked into so they get the education and training they need. The third set of papers are the referrals to the outside specialists, the ophthalmologists, dentistry, and podiatry. Because of some insurance constraints, we're not able to contract directly with the specialists in the community, so all the referrals will be going to Highland. Our referral coordinator will initiate these referrals and then track them to make sure that the patient goes to them. The form that tracks the health maintenance is a form, and on the back of that form is what we call a medical assistant's signature sheet. So every time a medical assistant reviews the standing order, they will sign off that they have reviewed it and the tests have been initiated. Throughout the year, every time the patient comes in, the medical assistant or whoever is reviewing that chart is to make sure that the tests that have been ordered by the standing order has been done. If not, they're to, again, make sure the patient gets the referral or get the lab sheet or get the diagnostic form so that it can be done. We hope by doing this, all our patients will get the optimal care they need and their outcomes will be as good as possible. Thank you.